This video is made to give an overview of the work that Regenerating Sonora is doing specific to health. So as you know, Regenerating Sonora is nurturing local potential for a resilient and thriving future. And we have a big vision and a big goal, and that's to help Superior, Arizona become the healthiest and most resilient rural community in the nation. So we're going to focus on health in the rest of this presentation. We can start off by asking the question, what do you mean by health? And what about the social determinants of health? So the WHO defines social determinants of health as the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. And there's been some good things about the social determinants of health. And one of the challenges that has been noticed is that in the process of trying to list out every single one of the determinants of health, it's resulted in really long lists that people can't really build consensus or align around. So without a shared course of action from multiple stakeholders, the social determinants of health framework has not yielded the benefits that it really could. Enter the Rippel Foundation's popularization of the 7 vital conditions for health, which you can see here. So in the center, you have belonging and civic muscle. And that's really what makes the wheel go round, as it were. And the other 6 conditions: thriving natural world, basic needs for health and safety, humane housing, meaningful work and wealth, lifelong learning, and reliable transportation. Now let's meet Becky Payne. She's the CEO of the Rippel Foundation, and she has her background in the CDC and the Department of Health, and she brings that knowledge to Rippel and her experience directly working with over 40 federal agencies to come up with this framework to begin with. So let's hear from Becky.
Before coming to the Rippel Foundation, I was fortunate to be in federal service for a long time. During the COVID pandemic, I had the great joy of working across the federal government, bringing together over 30 agencies to think about how should we be working differently in light of all the lessons learned from the failed systems during the pandemic. I also really like the framework because it centers belonging and civic muscle. Belonging and civic muscle is one of the 7 vital conditions in its own right, but it is also an outsized importance in terms of what it contributes to the whole framework. It is by building belonging, a sense of connection, people knowing that people care about them, that they have social connection, and civic muscle, where people have agency to make change at the local level in all forms.
Let's keep going with how we've been able to partner with the Rippel Foundation. So we've developed a strong relationship with the Rippel Foundation thanks to our friend Mark Pearson, who introduced us to them, and we naturally align with their 7 vital conditions for health. So it doesn't take much to see how you can just map all of our programs, initiatives, and efforts onto this framework. And it all fits very easily without too much change or stress to make it all fit. So you think about the fact that you have over 40 federal agencies coordinating around this framework, and at the same time, it's able to seamlessly map to the work that we're doing on the ground. That's always a really good sign of an effective framework. And we've developed a strong partnership with them, as mentioned. Here you can see Becky giving Regenerating Sonora a shout out for the work that we're doing. And there'll be links to the podcast episode that we're in, the event that we were asked to speak at, and an article that the Rippel Foundation did on our work as well. And also Bobby, the director of systems strategy. He's also a visiting scientist for MIT's Sloan School of Management. And here's what he has to say about regenerating Sonora.
Hi friends in Superior, Arizona. The work that you're doing is touching so many lives, not just locally in your community, but colleagues like me and our team at Rethink Health and Rippel, who've just been consistently inspired by the kind of love that you're displaying for each other and for the places that you care so much about. I'm just delighted to have been touched and to learn from a distance at what you're doing. And you're teaching us all what it takes to turn toward each other at a time that so many others are really turning away. So keep up the good work. I can't wait for what's next together. And as Chris says, if we're not having fun, we're fucked.
So all of Regen's efforts advance health via one or more vital condition. But it's our community health workers who are the most focused on improving Superior's health. You can look on our website under the Community Health Initiative to learn more. In brief, a community health worker is a trusted member of the community who fills the gap between people in the neighborhood and health-related services. Our CHWs are well-trained and equipped to partner with their neighbors to help them move past the many obstacles in the way of living a healthier life. So they help with many things, including transportation assistance, help applying for services, creating custom health plans, being health advocates, and much more. So with all this focus on health, what about the Blue Zone Project? How closely are Regen Sonora's efforts aligned with that?
What if we could reverse engineer longevity? I spent the last 20 years trying to do just that. Instead of looking for answers in test tubes, I found 5 places around the world called blue zones where people are living to 100 at the highest rates in the world. What is the secret to living a long time?
Community. If you're depressed, you're not going to live very long.
These secrets could help every one of us to get every good year we can get out of this body of ours. That is the promise of Blue Zones.
The Blue Zone Project is a community-wide well-being initiative inspired by research on regions where people live significantly longer and healthier lives. It aims to help communities design environments and implement lifestyle changes that promote longevity, better health, and increased happiness by encouraging people to adopt habits observed in the world's longest living populations. So ways that you can jump on the Blue Zone bandwagon. There's those that are directly in our control, like Regen Sonora could become a Blue Zone participating organization. We could adopt at least 2 Blue Zone inspired recipes in our kitchen. Then there's things not directly in our control. This would be like Superior signs on to become a Blue Zone project community, or the school signs on to become a Blue Zone project school. Let's look at how Regen Sonora is already aligned with many aspects of the Blue Zone project. There's a checklist for what you need to do in order to become a participating organization. And it turns out we tick almost all the boxes necessary already to become a participating organization. So there wouldn't be hardly anything we need to do to qualify. Our kitchen, as mentioned before, we could start using the longevity food list that they promote, and plus incorporating the 4 always that they've outlined, and adopting those recipes as mentioned. So these are things that we could do without a lot of change. And our work to help people eat locally and produce their own food aligns with many Blue Zone recommended activities. One of the main aspects of the work is to make it easy to eat wisely, which we're doing with our Eat Local initiative. So the Blue Zone project was developed by ShareCare, a personal health record provider. ShareCare promotes their community well-being index. And what they say about it is it's a better index for insights and impact to measure what matters to community well-being. So if we look at that index, let's compare it to the 7 vital conditions. What you'll see is that there's almost no conflict with the vital conditions and with this community well-being index. The only thing that's missing from their index is there's really nothing about lifelong learning. Other than that, you can see how everything here is covered. Then we can look at how Regen's initiatives align with ShareCare's community well-being index as well. As you can see, Community resilience isn't really mapped to that index, but all the other efforts that we're doing maps very well. So we're covering every single one of the community well-being index items. As far as blue zones go, Scottsdale is the only place in Arizona trying to be a blue zone. So Superior could be the first rural community in Arizona to take on this effort. In short, we're well positioned to jump on the Blue Zone project bandwagon with little change to our ongoing efforts. There could be upside to taking part of a recognizable movement. So some of the benefits of jumping on the bandwagon, it could allow us to gain broader community buy-in for our long-term goal of becoming the healthiest rural community. We could get the town government, schools, restaurants, businesses, individuals involved in something that they can see as bigger than themselves and is easy to talk about. It could also generate more attention and interest in Superior as a whole from a wide audience. It could potentially also gain us support from a donor base that specifically wants to support blue zones. And it could help us to gain more support from donors by easily articulating our health efforts within the Blue Zone project story and framing.
What are the risks? Well, there's the possibility that people are turned off by the prescriptive nature of the Blue Zones project. In order for them to scale this initiative across the world, they have a lot of checklists and specific things that they ask people to do, which may not be well received by our community. We just don't know. Another is that energy around the idea could wane and we're left talking about something that people don't care about anymore. So we make a big splash on blue zones, and then the energy and interest dies, and now we're kind of beating a dead horse, could be one of the concerns. Another is that this whole effort gets co-opted, and next thing you know, you have a group like The Mine allowing themselves to wave the flag of health and wellness while they also attempt to destroy our environment. So what do you do about this? Well, our preferred approach is not to jump into something, but instead to probe and conduct safe-to-fail experiments to see what reality has to say. So we have questions like, how involved with the Blue Zone project do we want to be? And one thing we can ask to start to give us an answer is, how well are our tests being received? So what we're going to do is, first we'll be screening the Blue Zone episodes during our movie nights that we have once a month. The other is we're going to try out Blue Zone inspired recipes at each one of those screenings. And third, we're going to plant a bunch of lavender and we'll offer it to people to put at their bedsides, as that's one of the specific things that was mentioned on one of the checklists. We'll run these 3 tests and gather feedback to determine if we should go further with adopting and promoting the Blue Zone project or not. So we'll have questions like, how was the post-viewing discussion after each one of these Blue Zone screenings? We'll have a discussion with everyone there at the end, and we want to see what kind of comments came from that discussion to give us a sense of what direction we should move in. How did everyone like the inspired meals? That means cooking the meals and also eating the meal. And did people actually get those lavender plants and put them next to their beds? And what did they say about that? Any feedback we'd like to know. So now let's look at Regen Sonora's recent and upcoming happenings related to health. What I want to demonstrate here is that no matter what path we take, we're already hard at work advancing the health of our community. So in October, we synthesized our community assessment that we did in partnership with ASU's College of Health Solutions and the Governor's Office of Youth, Faith, and Family. We were able to get about 1% of Superior's population to respond, and we got some interesting data like how important it was for people to receive mental health services in person. I don't want to talk to a therapist over the internet or online. I want to talk to someone in person. One of the questions that we had asked was, what mental health services are needed in town? Answer, simply put, as much as possible. So you can see that 77% of respondents said that their household is struggling with depression. And there's a lot of other concerning data on this slide too that you can see. So
Let's see what we did after getting this information. How did we respond? Well, the following month, we began our relationship with Mercy Care, who is our REBA, that is our Regional Behavioral Health Authority. They're the ones that Pinal County contracts with to provide mental health services for general mental health and severe mental illness. So we had 4 of their team members come during a Monday morning breakfast to discuss these assessment results, and that led to a number of other things. Like later on that month, our main contact at Mercy Care, Heather, came back and conducted a suicide prevention training during a Wednesday dinner service at Leo's. Also, we had Hope Women's Center began coming to Leo's every Wednesday from 1 to 4 p.m., and that started on January 17th, and that's to provide free in-person classes and one-on-one support to women and teen girls facing any difficult life situation. Psychiatric mental health nurse practitioner Tony Ornelas provides services throughout Pinal County, and he's a Superior local. He came to Leo's and conducted part 1 in a series on overcoming depression. January 28th, Mary Martha Armitage officially became Superior's first state certified community health worker. And the very next day, she helped a community member get their utilities turned back on thanks to work that she's been doing with CARA and DES. And that person was living without electricity for about 2 weeks. February 3rd, we spoke with Program Manager for the Public Health Services District, Reina Villegas, and that was to explore goal alignment between her efforts and ours and to see what kind of resources our residents here could take advantage of. Slow but steady progress with Horizon Health and Wellness. So this is the group that Mercy Care assigned to address the in-person services that we're requesting for mental health, and we're slowly but surely getting our MOU set up so that way we can actually start these services. You can see an excerpt from an email where they say, I don't want to let you know that we have hired a clinician who will be able to provide some services in Superior, but she does not start with the agency until sometime in March. So again, we're making progress. Coming up on the 10th, we have an initial meeting scheduled with Karen over at Arizona Department of Health Services, and her work is specifically dealing with population health, and we want to see what goals we can align and what resources she may know about that we should be taking advantage of. And then we mentioned earlier that movie night, so that's going to happen on February 11th. We'll kick off watching the series and we'll conduct a community discussion to get a sense of how interested people are in this topic, and we'll keep that going for every episode. So for the next few months, we'll be doing this. Then on the 18th, backed by popular demand, Tony Ornelas is coming back to Leo's to conduct another workshop on overcoming depression. So this is a series that we're going to keep going as long as people are interested. On March 9th, we have Community Cares, which is the group that provides the closed loop referral system that our community health workers use. They're going to be coming to Leo's and bringing service providers all throughout Pinal County to come to Leo's to talk about the closed loop referral system and to have a collaborative discussion around how we can better collaborate with each other to help the health of residents in Pinal County. And last but not least, I should mention that Mark Pearson, who helped us get in touch with the Rippel Foundation, is in touch with us every week. We're talking with him about how we can advance our health efforts. And so his background, he's an emergency physician. He served on the executive team for St. Joseph Hospital / Peace Health for more than 17 years, where he developed the first patient-controlled health record, which inspired Microsoft Health Vault and advanced the use of electronic medical records in the field. So he's traveled all over the country providing insights on how he was able to scale a community health worker program across multiple counties in the state of Washington, and he regularly connects us with national leaders in the health field. And there'll be more developments about that as time goes on. So there you have it. While we're providing ongoing services to meet immediate needs, we're building the partnerships necessary to change the systems that cause the various problems we're facing to begin with. All this is to move us closer to our goal of helping Superior to become the healthiest, most resilient rural community in the nation. We look forward to your feedback. Thank you.